Welcome, everyone. Thank you for joining us for today's episode of Dare to Age Well Now. I'm very excited to be joined by my guest, Dr. Allison Bremner, joining us from Colorado. Allison, will you tell us a little bit about yourself?
Yeah, well, I'm at home today, so I'm in a comfy sweatshirt. So thanks for letting me just be comfortable. I am a specialized chiropractor. We work with the top of the neck, see a lot of conditions like vertigo, migraines, brain fog, post-concussion syndrome. I've been in Colorado for, I think 13 years. I'm originally from California, and I bought a practice out here that was the same specialty that I wanted to do. And I love being in the practice and helping people get back. Colorado's a very active state, and so a lot of times people come in with their conditions because they can't do the things they would love, hiking and skiing. Sometimes those things cause their condition with a skiing accident, something like that.
Right.
But people really, I think in Colorado, people want to be healthy, and there's so many groups for that, and so that's why people come to see me. Is they want to be able, as they age, continue to just be active and be happy.
What's interesting is as I've launched this podcast, I have friends that I didn't know this was their perspective. They were like, wait, you go to a chiropractor besides for back pain? Like, I thought it was only if I had back pain or if I got whiplash. Mm-hmm. And I'm like, wait, what? That's the only time you're going to a chiropractor? Like, I go to a chiropractor before I go to a regular doctor because, like, usually there's some alignment issues. I've got something somewhere. But I love that you actually specialize, you said, in the upper
the
part.
top neck.
Yeah.
Mm-hmm.
Top neck. So, why that narrow of a focus?
Yeah, well, I mean, like chiropractic is a very interesting profession. So much like medical doctors, you can specialize in like sports or pediatric, neurologically based. I played basketball in college. I thought I was going to be a sports doc. But I quickly found that athletes like myself, I'm a terrible patient. They're like, oh, my elbow hurts, my knee hurts. Like, they don't really want to be well. They want to be good enough to play. And I was like, man, that's kind of frustrating because, like you were saying, there's so much more to chiropractic wellness and your brain function, all these things. And when I was in school, I started learning about this is called upper cervical. So cervical meaning your top bones in your neck. And they started talking about complex cases, people who are really suffering and did not know what to do. They go to the medical doctor and their tests are negative. So it's like, hey, your CT's negative, your MRI is totally fine, your blood work's fine. There's nothing wrong with you. And they're like, well, something's definitely wrong with me. Right. And these are the kind of cases that I thought would be really rewarding and I could do for a long period of time. And honestly, just not get bored because you're just seeing people's lives dramatically change. So that's why I got into that focus. We can talk about the science of the neurological input to the brain at that area, but that area has the most input to be able to change the way the brain is in what's called sympathetic dominance, that fight or flight. When you feel really anxious or scared, your sympathetic nervous system is kind of off the chart. And unfortunately, most women, as they get older, sort of deal with these sort of issues, and that adjustment brings them back into what's called parasympathetic, that rest and digest kind of. After you eat a big turkey dinner, you kind of feel that nice rest and digest. And that's how your body should be at most cases. You shouldn't feel anxious all the time. You shouldn't feel stressed all the time. And so that's why that specialty is just basically the influence of that adjustment to the brain.
I love that because as I had those conversations with people and they're like, why would you go to the chiropractor first? I'm like, well, I don't know why this isn't logical to others, but like if your spine is out of alignment, that seems pretty obvious, even just from looking at a little skeleton in 10th grade biology,
yeah.
that could be a problem, that could cause some problems. I don't know. That seems logical to me. And then when you get up all in that neck area, like I've never thought about it having the most connections. Duh. I should have, but yeah.
Well, and I think with most people, it's just like, to your point, they just never thought about it. But once they think about it, like most people come in and they go, oh man, that just makes a lot of sense. Mm-hmm. No one ever told me that before. Right. And a lot of times they're like, I don't know what the problem is, but it's something in my head, my neck right here. I don't know. My doctor said it's not connected, but I feel like there's something there. And it's just like, yes, there is something there. And let's talk about it,
Yeah.
And so, I think that's also what I get to see change is like people not only their health changed, but their lives changed because they're, man, I can control my health. If I'm healthy, if I have my right alignment and my brain working, I can actually heal myself. That's pretty cool. And they think about, well, what else do I have control over? They start to change the way they're thinking. Because unfortunately, we're going into this kind of thought process where like you're like a victim of your circumstances, right? So you're just like, oh man, it's just bad luck, or like things are so negative, there's nothing I can do about it. But really, you can just change your focus, and you have control over your happiness, and you have control of your health, you have control over all these things in your life. And so that's also what I enjoy in the practice, is not just seeing people get better, but like understanding that they have so much control of their life and to be happy and healthy, really.
I love that. And one of your specialties I'm so intrigued, I want to jump into is around this, even though I'm struggling really hard not to quote Viktor Frankl right now. Because Viktor Frankl, okay, we gotta go there. Viktor Frankl, I love, he has a quote that says, when you can control nothing else, you can always control your attitude. And sometimes when I think or say that, I'm like, oh, I'm being Pollyanna. And then I'm like, wait, Viktor Frankl lived through concentration camps during the Holocaust. And if he can say that, then it's true. And I can say that. So I absolutely love that. Plus, I think that most of us women, like, we kind of like being control freaks. And so there's an element of this where it's like, finally, somebody is not telling me, oh, you need to just stop trying to control everything. Like, quite frankly, who am I supposed to let control everything then? And I get that there is like, we hold too tight to things, but there's an element of like the things inside my hula hoop, my attitude and my body and my health. I do want to be able to, and we have an almost a responsibility to take control of that, because who else is gonna if we don't take that responsibility? Love that. Fantastic.
Yeah, and most people, women especially, they come in and they're like, my doctor told me it's all in my head. And I'm like, well, it is in your head. It's your brain. Like, but there's something going on. It's not in your head as far as it's make-believe. It's that, hey, if your brain is not working correctly, because a lot of these things do not show up on test or imaging, right? So it's like, well, obviously, and, medical doctors, like, you should go to the medical doctor if you have an emergency, right? If your arm is chopped off, that's the best place. But if you're looking for health, it's the worst place. Because quite frankly, they're not trained in health. They're trained in emergency medicine. When you try to apply emergency medicine to overall health and wellness, you're never going to get a good response, because that's not what it's made for. And so I think people come in and it's like, this is the first time someone's listened to me and told me that it's not in my head. It's not something I'm just making up. And unfortunately, I think that that's what happens when the diagnosis is not necessarily clear, because it's not an emergency, it's a functional problem, that then it's, very much brushed off as, well, you just have to just live like this. That's the way it goes.
Yeah, and I have enough friends that are doctors and clients that are doctors, and I'm not trying to make them out. I think this system, our society, we've created a kind of a flawed system. And whether it's insurance or, I'm not going to get started on big pharma, on the answer to everything is not in a pill, I think it's the system that rewarded, and every system is designed to get the results it's getting, right? And so it's getting results, which is that people are getting sicker, so then they need more medication, and therefore they, like, there are people who are winning, and now I'm going to sound like a conspiracy theorist. I'm not trying to. Golly, I don't mean to do that, but I do think that we have to, no one's coming to save us, right?
Correct. You're going to have to take control. I have a lot of patients who are doctors and nurses because they see the system that their patients are in. And again, to your point that it's a time and place, it's a miscommunication. It's that the doctor is like, this is what I do. Like medical doctor,
Yeah.
this is what I do. So you've come to me and I'm going to give you my advice on what I do. And my tools are to give you drugs and surgery. Those are my tools. And they see the system though, right? And so like they come in, they're like, I don't want to take drugs because I see what happens. One, it's ineffective. Two, it can be addictive and has a lot of side effects. So, I think you're correct that it's that, our system is not great. And you have responsibility. You have responsibility of your health, you have responsibility of your wealth, you have responsibility of your happiness, which can sound a little daunting, but at the same time, that if you have responsibility for it, then that means you can change it.
Yeah.
You know?
It's funny because I've never thought of it this way, but for some reason, as you were talking and saying you have doctors and that come to you, well, of course you do. We wouldn't go to our family practice doctor and ask them to clean our teeth.
Right. Yeah.
Right? Like that seems obvious. I'm not going to go to an internal medicine doctor and say, hey, my tooth is hurting. We know that that's the right place to go for that. There's a different place to go for that type of situation. And so it makes sense that you use the tool that you need for the thing you need it. If you've got a cancer diagnosis, there may be like you probably need to see an oncologist, right? And find out and now we're not going to get into that. Anyway.
Yeah, and I think, well, like dentists have done a great job of educating the public that you go to the dentist to get your teeth cleaned. You don't just go because of a cavity. And chiropractors, unfortunately, have not done a great job of you don't just go to the chiropractor when something is really bad. You should go to make sure alignment is the way it should be so that you don't develop issues. So that's a little on chiropractic, it's a little on other things, but like the dentist is a great example of how you can teach the public to be proactive with their health. And that makes sense. Oh, if I didn't brush my teeth for 10 years and I go to the dentist, you're probably going to have a big problem,
Well, but I mean, it's been less than 100 years ago that was common practice, right? Because I remember reading about people didn't even know to brush their teeth, right? And that was the big campaigns, the big early people who did advertising campaigns actually were toothpaste, to be able to teach people this is what you do. Yep. Back in the days when we only lived to be 45 or 50, your teeth might have lasted that long, but
yeah, or you're eating things that are actually going to help clean the teeth instead of just processed crap. But
yeah,
and again, we can go down that road, but let's leave food and pharmaceuticals, maybe another topic, whole other podcast.
We'll have to get back to that. Okay, one of the things I was excited to talk to you about is vertigo.
Yeah.
I have, and also this does relate to the idea of people thinking it's in your head, because vertigo is this trippy thing that happens that is hard to explain. You have no outward physical, you're the only one that can know that you're having that experience. I had never had it until I got COVID the first time. And I didn't have it every day, which really messed with my brain and made me feel like maybe it is in my head, because it was about every second or third day. And so I'm like, who has a symptom every 3 days? And it wasn't all day, and I finally happened to be going in for my just annual wellness physical. And my doctor's like, oh, well, we need to work on your, vestibular system. Is that right? Yep.
Yeah.
And so why don't you tell us? Because Lord knows I do not need to be explaining a vestibular system when I have to remember how to say it. So tell us about that.
So we see a lot of vertigo. And the reason why is that it's really debilitating and there's not a ton of treatment for it as far as medicine. So you have to reestablish your function. And so you have your balance centers that are controlled by your eyes, your ears, and the upper part of your neck. And the three things have to be communicating together. Otherwise, you're going to get sensory mismatch. So the sensory input coming in from one of those places is not matching the sensory input coming from another place. So most commonly, people think, oh, I have vertigo. There could be crystals in my ears, which absolutely could be an issue. And so there's this Epley maneuver, Foster maneuver. There's different things you can put in different positions that drain the crystals so they're not irritating the inner ear. Your vestibular system of your eyes, a lot of times you will go and do rehabilitation and do different eye tests to make sure that sensory input's coming in. So both those things, there's different, it's usually a PT that does vestibular sort of treatment. EENT, medical doctors, sometimes PTs will do Epley. So those things a lot of times can help vertigo. Sometimes people do that and it gets a little bit better, but not all the way better, or sometimes it doesn't help at all because it actually is from the upper part of the neck. So the upper part of your neck, it basically gives you information to your brain. So you close your eyes, you have this thing called proprioceptive input. Big fancy word for saying balance information to your brain. So you don't fall down when you close your eyes because you have your spine telling your body where it is. And the most concentration of those proprioceptive input is the C1, which is that top vertebrae, on your occiput. So if someone has a neck issue, that can cause vertigo symptoms because that sensory input is not matching. Could be your eyes, could be your ears. Sometimes it's all three with people. Sometimes it's a little bit their vestibular, their eyes, sometimes a little bit, crystals in their ears, and sometimes it's their neck. So getting that established is really important, because with something like COVID or something like car accident, what you've done is you've put too much stress onto your body. So we talk about 3 different types of stresses: chemical stress, emotional stress, and physical stress. And a lot of times it's all 3 of those, but that's where COVID kind of fits into that kind of almost that chemical is different the way your body was responding to it. So that's why we see vertigo.
That is fascinating, because I have gotten COVID 3 times. I also got the vaccinations. And when I have hindsight and look back on them, it was always at a point where I was off the chart, stressed out. And I had been going and going and going and going. And I'm like, oh, well, yeah, look, your immune system couldn't fight it off because you didn't give it the tools that it needed. So then now that you're saying that, I hadn't really thought about it in terms of the stress response like that, or like that I was putting additional stress. It's like I was super stressed out physically and emotionally, like all kinds of stress, got COVID. I was a ripe candidate for the vertigo being an issue.
Yeah, I mean, almost all of our conditions in the modern world, 80% of them are chronic conditions caused by usually some sort of lifestyle. And so most people get sick because of stress. And we think of stress only as that emotional stress, right? You're stressing your job, your kids are stressing you out. And absolutely, most Americans deal with that. But the chemical stress, so that can be any sort of virus or bacteria, that can be the foods that you're eating. It could be, let's say you're working at a nail salon, breathing those fumes in all the time. And then there's the physical trauma. Most people have had a car accident, a slip and fall, and they think it's no big deal because at that time, your body releases a lot of adrenaline, so you don't feel pain. Maybe you've heard this, people like, oh, I walked away from a car accident and I was totally fine. But not totally fine. Like, scar tissue basically builds up in the joints to protect you so you don't die. But you lose function. And so you have to lose 60% of function before you ever have a symptom. And so, people really need to think about if your health is, let's try to minimize the stress so that you can adapt to the environment, and you want to make sure you're functioning at its highest level. Those 2 things will keep you very, very healthy. Once you get into the symptom, you're having symptoms, you've already lost a ton of function, and it's going to take time. You have to go backwards, basically, to restore the function and get health. And so anything that you can do, so eating well, going to the gym, going to the chiropractor, getting massages, energy healing, anything that's going to allow your body to adapt to more stress, you're going to be healthier, because that adaptation is the best thing for you.
I love that. And I got taken back to being a junior, senior in high school and was in a car accident. The vehicle rolled and I was thrown from the vehicle. I passed out laying there, and I woke up in time to see the truck start to roll toward me, and I rolled out of the way really fast, like near death, like thank you, Lord, for waking me up. Anyway, and the guys that were in the truck never saw me roll. They just are sitting there suspended and see me laying there, and then they roll down. And so when they get out, and I'm like freaking out, they're like, you're alive, oh my gosh. Walked home, we walked until one of our friends, we were out in rural Arkansas, walked until one of our friends picked us up. There were no cell phones like this. We had to get back to town till we could, anyway, they took me home, and then about a half hour later, the police officer from our town shows up. Hi. Then my grandma calls and is like, are you okay? And I've never told this story on a podcast. Anyway, I was like, I'm fine. I don't need to go to the doctor. Grandma, please, seriously. I mean, I'm fine. And so she came home that night and stayed with me. And the next day, I thought I was going to die. I mean, I was in so much pain. But absolutely, to your point, for hours, I was fine. I was totally fine.
Well,
And
yeah, we have to have those in order
yeah,
to survive things, right?
yeah.
And
And then
because like you had to like even back then without cell phones you had to walk home. But imagine even like before that, before like civilization, if you were in danger, you would have to get back to your cave or whatever to get to
right.
safety. So you
Yeah.
have these mechanisms to allow you to not feel pain and to push through and have adrenaline so that you can survive. And it's still we're still that animal today, but
And
we
we are
live in
still
a
doing that. Yeah.
different society.
Yeah. Well, and sadly, back then I didn't know to go to the chiropractor. I was raised and told that chiropractors were a quack and that you would always have to go to them and they don't actually fix anything. All of these now what I consider super crazy ideas.
Yeah.
Because I've literally come 180-degree difference on that opinion, and I can't be alone. I know that there are people that have. I think it's better now than it used to be.
I think you're right, and I think that people what's really happened is that in any way to change a worldview is typically people have to have an experience.
Yep.
And what people are experiencing right now is pretty much disdain for the medical society or the industry, if you will. And
Yeah.
again, nothing against medical doctors. I think you're right. They're in a system that they just really have no control over. But they go in, you're listening to 30 seconds, and it's usually not even the doctor. It's like some nurse or PA or assistant that's like taking your vitals, not listening to you, putting the chart. The doctor comes in for 30 seconds, like, oh, Mrs. Jones, it looks like you have migraines. Here's a medication. If you need any again, let me know. And they're out of there because they have a quota that the hospital's forcing them to see a certain amount of patients, or they're not getting their bonuses or getting paid properly, and they're overworked. They don't have time to talk to people, and so because of that experience, people are starting to be like, well, I don't really want to go to that. And then they'll have a positive experience with a chiropractor who it's their office, right?
Yeah.
They're controlling the office, so they're controlling the environment, and they're like genuinely concerned with their patient, and they have the freedom and opportunity to actually spend time with that person. And so I think that the experience of that alone, not necessarily is chiropractic weird or not, I think it's like, oh, I can go to someone that will listen to me and that won't just prescribe me drugs, because the last 3 times I went to the doctor, that's all they did, and these drugs did not help, and they made me feel terrible, and I want different. So I think that that's actually the paradigm that shift. It's that
That's awesome.
they've actually given us the opportunity. The pharmaceutical industry has given us the opportunity to step into this role of like, oh, I'm actually going to listen to you, and I'm actually going to give you functional advice that's not just going to cover up your symptom. So I think that that's why more people are open to someone that's going to help them function better rather than just cover up their symptom with medication.
I love that. That's fantastic. Dr. Allison, tell us if someone wants to come and be listened to and they're in the Colorado area, where can they find you online?
Yeah, so my website, just my first and last name, AllisonBremner.com. So it's ALISON And so that's our website. And we're in Boulder, which is, if you're familiar with Colorado, it's a little outside Denver, about 30 minutes outside Denver, a little northwest. And I do phone consultations all the time. And also this kind of specialized chiropractic, there are people all over the country. So, if you want to just reach out to me, you can reach out to, so Atlas Chiropractic is the name of my clinic. You can reach out to me and ask, hey, is there somebody in this area? Is there somebody in that area? Because the thing is, I just want you to get help. And if we can find someone near you, great. We have had people fly over for care out of state, out of country, and people do that if there's just really no one near them. But yeah, that's the best way, I would say, to reach out to us.
That's fantastic. Thank you so much for being here today. I really appreciate it.
You're welcome. Thanks for having me on.
Absolutely. And for those of you that are listening, if you liked this podcast, please subscribe, like, share. Join us over on, if you haven't followed us on Substack, we're actually continuing the conversation there, and it's a little more interactive, building a kind of cool community. So would love to see you over on Substack. And all of those links will be in the show notes. Until next time, I hope this has inspired you to dare to age well now.